I think it particularly becomes relevant once the mandates are eased, because it is a way to, in a way, a sneaky way to have like a kind of ongoing mandate on all allied health professionals.
I'm Yemini for Rebel News in Melbourne, Australia. Now, the whole conversation has been dominated in recent weeks about the potential of the mandated fourth jab for nurses in places like the hospital behind me. While that's been happening, nobody has been discussing what the governing body in Australia is doing to essentially continue mandates going even after the pandemic.
I have been a registered health professional for more than 10 years here in Victoria, and something recently has come to my attention is that Ahpra is actually changing the code of conduct for allied health professionals. In the existing code of conduct, it says that health practitioners need to have an understanding of the principles of immunisation. So just an understanding of the principles of immunisation of communicable diseases. Whereas the new code of conduct coming in on the 29th of June, it has added this extra clause that says that practitioners are now immunised against any relevant communicable disease. So it's slight difference in wording, but big difference in application.
Essentially what it means is when the pandemic powers end and the mandates are supposed to be dropped, well, whether it's medical practitioners or any other industry, it can be written into their code of conduct that they have to be vaccinated. And not just against COVID, this could be against anything they decide. So our mandate's ending? Well, if this is anything to go by, I'd really question it.
The code of conduct talks about a lot of different things like respecting patients, human rights, and...
Isn't that ironic? But I guess the question, though, for me would be, is it grounds for you to either lose your licence or not be able to renew your licence as a health professional, or you don't even know?
We don't know if it's going to be actively enforced, but I just believe, why would they make this change unless they want something to come from it? So whether that means that they're going to later on request a vaccine passport to renew your licence, or whether it means they're going to use it as the groundwork for private businesses and hospitals to implement this within their own individual policies, we don't know. I do believe there probably are some health practitioners sitting on the sidelines waiting for mandates to end or state of emergencies to end in various states. Maybe they're working in a limited capacity from home. Maybe they're on extended breaks or maternity leave, or just working in another job right now. But if something like this is put into the code of conduct, then maybe that means they can't even work from home or come back at a later date when the state of emergency ends.
If you think it's important for people to know what's going on, because it seems like most people are missing the point by focusing solely on the fourth jab for nurses, then make sure to like, comment, and most importantly, share this story far and wide. Let people know what's going on, and then make sure never to miss a thing. Go to followavi.com, follow me across all my socials, join our mailing list to ensure that even if they ban us off the platform you're watching on right now, you'll never miss a thing. Followavi.com.